Welcome to today's Explainer. I'm a licensed pelvic floor physiotherapist at OVA Women's Health. Listen, if you've been dealing with pelvic pain, urinary incontinence, or fecal incontinence, I want you to know right off the bat you're in exactly the right place. These conditions, they can feel incredibly isolating, right? Super frustrating, like your own body is just betraying you. But today, we're going to unpack exactly what is happening in your body, why it's happening, and, most importantly, exactly how we can actually heal it together. I want you to take a second and really absorb this quote right here. Incontinence is not something you just have to live with. If you've spent years being dismissed, or maybe you've been told your symptoms are all in your head, or hey, maybe you've just kind of internalized the idea that leakage is simply an unavoidable part of being a woman, well, I'm here to tell you, no way. That's absolutely not true. Your pain is real, your frustration is completely valid, and you definitely deserve to feel better. Section 1, Validation and the Clinical Reality. Okay, let's dive into this because, understanding the clinical reality of what's physically happening inside your body, that's a very first step toward reclaiming your life and your confidence. So what is it? At its core, incontinence happens when your pelvic floor muscles, your bladder, your bowel, or your nervous system simply can't coordinate properly. It's kind of like a giant orchestra where the conductor has just stepped out for a coffee. That communication breakdown is exactly what leads to that unexpected leakage or loss of control. And I really want to stress this as a clinician. This is a mechanical, physical coordination issue. It is not a personal feeling, it's not a lack of willpower, and it is literally nothing you did wrong. Now, what's really interesting about this slide is how this lack of coordination shows up in a few distinct ways. First up, we've got urinary incontinence, or UI. This often presents as stress incontinence, like when you leak a little bit during a cough, a sneeze, or hitting the gym. Or it can be urge incontinence, that sudden, intense panic of needing to go right this second. Then there's fecal incontinence, which is the inability to control bowel movements. That can range from an unexpected slip of gas all the way to actual stool leakage. You might be experiencing just one of these, or honestly a mix of both, which we see all the time in the clinic. I want to repeat a mantra we use literally every day with our patients at OVA Women's Health. Incontinence is common, but it is not normal. We see so many jokes in movies or greeting cards, right? Women laughing so hard they pee their pants. And yes, so many women experience these symptoms, but you do not have to accept them as your permanent reality. There's a massive clinical difference between a condition happening frequently to a lot of people and that condition being an inevitable, unchangeable state. Section 2. Causes and risk factors. So why does this actually happen? Let's transition into the specific root causes and risk factors that trigger urinary and fecal incontinence. First off, let's tackle a question I hear almost every single day in my practice. Is this just a normal part of getting older? The answer is a resounding no. Now, yes, natural hormonal changes, especially decreasing estrogen as we age, do affect your pelvic floor muscle tone, bladder tissue, and nerve sensitivity, but that absolutely doesn't mean you just have to surrender your continence. I've worked with patients in their 70s and 80s who've completely eliminated their leakage. This condition is highly treatable, for sure, at any stage of life. Let's look at the primary physical causes here. Often, the whole thing starts with pelvic floor muscle dysfunction. This can mean the muscles are too weak, sure, but actually it can also mean they're overactive, holding way too much tension to function properly. Then we have the immense physical toll of childbirth. Traumas like perineal tearing, prolonged pushing, or delivering a large baby can really stretch or injure the vital nerves and muscles that control continence. I see so many moms in the clinic who think leaking after childbirth is just their new normal forever, but we can actively repair that muscle dysfunction. And finally, surgery or pelvic trauma. Things like a hysterectomy or prolapse repair can drastically alter your deep core strength and support system. And this brilliantly illustrates how secondary factors play a huge role in disrupting nerve signals and pelvic support too. We're talking about neurological conditions like multiple sclerosis, Parkinson's, or diabetes, which can reduce sensation and muscle activation. Then there are lifestyle factors, increased abdominal pressure from carrying extra weight, or the chronic coughing associated with smoking. These put repeated daily strain on those delicate muscles. Even chronic constipation forces you to strain. It acts like a repetitive stress injury that just progressively weakens your pelvic floor over time. Section 3, How Pelvic Physiotherapy Helps. Now that we know exactly what's happening and why, let's shift gears from the problem to the evidence-based hope and solution. Let's look at how specialized pelvic physiotherapy actually fixes this. Listen, if any of what we've covered so far sounds familiar, I want you to just take a deep breath, save this explainer, and stay right here with me, because there is a solution. You are not broken, and real relief is entirely possible. As a pelvic floor physiotherapist, I take a very specific, holistic approach to your healing. We focus on 4 key steps: targeted exercise and coordination, biofeedback, manual therapy, and lifestyle education. And let me be incredibly clear here. This is not just about handing you a printout of generic Kegel exercises to do at home. Actually, scratch that. If your muscles are overactive and holding too much tension, doing Kegels can literally make your incontinence worse. Our approach is vastly more sophisticated than that. So the crucial point is how these specific, non-invasive techniques directly address the root causes we talked about earlier. Targeted exercise doesn't just strengthen weak muscles, it actively teaches tight, overactive muscles how to finally let go and relax. We also use biofeedback. This is super cool. You can actually see your muscles working on a screen, giving you real-time visual training for proper control. Manual therapy allows us to physically reduce tension and release painful trigger points inside the pelvis. And our lifestyle education optimizes your daily habits, things like managing fluid intake, tweaking your diet, and even correcting your posture on the toilet to ensure long-term, lasting success. Now, you might be wondering, okay, what does a realistic timeline look like? 4 to 6. That's the number of weeks most women need to start noticing real, tangible changes in their bodies with consistent therapy. Pelvic floor physiotherapy is an evidence-based, highly effective, first-line treatment for both urinary and fecal incontinence. You don't have to wait years to start feeling the benefits. You can literally start reclaiming your life in just over a month. Section 4, the OVA clinic difference. Finding the right care provider is absolutely essential to this journey. Let's talk about where you can access this level of highly specialized, safe, and effective care. At OVA Women's Health in Burnaby, BC, we do things a bit differently. Pelvic floor dysfunction, pelvic pain, and conditions like urinary and fecal incontinence, they aren't just a small add-on service in some general physiotherapy practice for us. This is our dedicated specialty. It's what we study relentlessly, and it's what we treat all day, every day. When you choose OVA Women's Health, you're getting care from professionals with advanced training in complex pelvic health. There are 0 generic programs here. Your treatment is entirely individualized based on your unique anatomy. We take a whole-body approach. We look at how your posture, your breathing mechanics, and your nervous system deeply interact with your pelvic floor. And most importantly, we provide a compassionate, completely private, and unhurried environment. Your appointments are a safe space where your pain is taken seriously. You will never, ever feel judged with us. Section 5, start your healing journey. Let's move to and see how this builds into real action for you today. Because hey, understanding the science is a wonderful start, but taking action is how you truly begin to heal. You can scan the image on screen to book your confidential consultation with us at OVA Women's Health. The booking process is warm, simple, and entirely focused on getting you the help you need. I also want to make sure you know this. You do not need a doctor's referral to begin. None at all. You can completely bypass the waiting room and reach out to us directly to secure your spot. I want to leave you with this final thought today. You have been patient long enough, and specialist help exists. You don't have to spend the rest of your life mapping out public washrooms, dealing with chronic pelvic pain, or avoiding the activities you love just out of fear. You deserve to feel strong, confident, and completely in control of your own body. So I have one final question for you. What could your life look like if you never had to map out a public washroom ever again? Take that very first step toward healing today. We look forward to supporting you on your journey.